Good morning. Page 107. Chapter titled Dominoes. The orderlies lifted me off the scales, but their cold, powerful hands would not let me touch the ground. How much, the doctor shouted, dipping his pen into the inkwell with a click. 106 pounds. They put me on the stretcher. My height was 6 feet, and my normal weight was 177 pounds. Bones constitute 42% of a man's total weight, 74 pounds in my case. On that icy evening, I had only 32 pounds of skin, organs, and brain. I was unable to make this classification at the time, but I vaguely realized that the doctor peering at me from under his eyebrows was doing precisely that. He unlocked the desk drawer, carefully pulled out a thermometer, leaned over me, and gently placed it under my left armpit. Immediately, one of the orderlies pressed my arm to my chest, and the other grasped my left wrist with both hands. Later, I came to understand these carefully planned movements. There was only one thermometer in the hospital of 100 beds. The value of this piece of glass was measured on a totally new scale. It was treasured as if it were a rare jewel. Only very seriously ill and new patients could have their temperature taken with this instrument. The temperature of recovering patients was recorded according to their pulse. And only in instances of doubt was the desk drawer unlocked. The wind-up clock on the wall chimed 10 o'clock, and the doctor carefully extracted the thermometer. The orderly's hands relaxed. 93.7 degrees, the doctor said. Can you answer? I indicated with my eyes that I could. I was saving my strength. I could only pronounce words slowly and with great difficulty, as if translating from a foreign language. I had forgotten everything. I didn't even remember what it was like to remember. They finished recording the history of my disease, and the orderlies lifted the stretcher on which I lay face up. Take him to the 6th ward, the doctor said, close to the stove. They put me next to the stove on a wooden cot supported by sawhorses. The mattresses were stuffed with branches of dwarf cedar. The needles had fallen off, dried up, and the naked branches protruded menacingly from under the dirty, striped material. Straw dust seeped from the grimy, tightly packed pillow. A thin, washed-out cotton blanket with the word feet sewn in gray letters covered me from the entire world. The twine-like muscles of my arms and legs ached, and my frostbitten fingers and toes itched. But fatigue was stronger than pain. I curled up on my side, seized my legs with my hands, leaned my chin against the coarse crocodile-like skin of my knees, and fell asleep. I awoke many hours later. My breakfasts, dinners, and suppers were on the floor next to the cot. Stretching out my hand, I grabbed the nearest tin bowl and began to eat everything in the order in which the bowls lay. From time to time, I would nibble on some of the bread ration. Other patients on similar wooden cots supported by sawhorses watched me swallow the food. They did not ask who I was or where I came from. My crocodile skin spoke for itself. They didn't want to stare at me, but they couldn't help it. I knew myself how impossible it was to tear your eyes away from the sight of a man eating. I ate all the food that had been left for me. Then there came a warmth, an ecstatic weight in my belly, and again sleep, but not for long this time, since an orderly had come for me. I threw over my shoulders the only gown in the ward, filthy, burned by cigarette butts, and heavy with the absorbed sweat of hundreds of people. It was also used as a coat. I stuck my feet into the enormous slippers and shuffled behind the orderly to the treatment room. I had to go slowly, since I was afraid of falling. The same young doctor stood by the window and stared out at the street through frosty panes shaggy from the ice that had formed on them. A rag hung from the corner of the sill, and water dripped from it, drop by drop, into a tin dinner bowl. The cast iron stove hummed. I stopped, clinging with both hands to the orderly. "Let's continue," the doctor said. "It's cold," I answered quietly. The food I had eaten had ceased to warm me. "Sit down next to the stove. Where did you work?" "Before prison." I spread my lips and moved my jaw. My intention was to produce a smile. The doctor understood and smiled in reply. "My name is Andrei Mikhailovich," he said. "You don't need any treatment." I felt a sucking sensation in the pit of my stomach. "That's right," he repeated in a loud voice. "You don't need any treatment. You need to be fed and washed. You have to lie still and eat. I know your mattresses aren't feather beds, but they're better than nothing. Just don't lie in one position for too long, and you won't get bed sores. You'll be in the hospital for about 2 months, and then spring will be here." The doctor smiled. I was, of course, elated. An entire 2 months, but I was too weak to express this joy. I gripped the stool with both hands and said nothing. The doctor wrote something into my case history. "You can go now." I returned to the ward, slept into 8. In a week, I was already walking shakily around the ward, the corridor, and the other wards. I looked for people who were chewing, swallowing. I stared at their mouths, for the more I rested, the more I wanted to eat. In the hospital, as in camp, no spoons were issued. We had to learn to get along without knives and forks while we were still in prison under investigation. And we had long since learned to slurp up our food without a spoon. Neither the soup nor the porridge was ever thick enough to require a spoon. A finger, a crust of bread, and one's own tongue were enough to clean the bottom of a pot or bowl. I searched out mouths in the process of chewing. It was an inconsistent demand of my body, and Andrei Mikhailovich was familiar with the feeling. One night the orderly woke me up. The ward was filled with the unusual nocturnal hospital sounds, snoring, wheezing, groans, something talking in its sleep. It all blended into the single peculiar symphony of sound, if a symphony can be composed of such sounds. Take me to such a place blindfolded, and I will always recognize a camp hospital. On the windowsill was a lamp, a tin saucer with some sort of oil, but not fish oil this time, and a smoking wick twisted from cotton wool. It couldn't have been very late. Lights went out at 9 o'clock, and somehow we would fall asleep right away, just as soon as our hands and feet warmed up. "Andrei Mikhailovich wants you," the orderly said. "Kozlik will show you the way." The patient called Kozlik was standing in front of me. I walked up to the tin basin, washed my hands and face, and returned to the ward to dry them on the pillowcase. There was a single towel for the entire ward, an enormous thing made from an old striped mattress, and it was available only in the morning. Andrei Mikhailovich lived in the hospital in one of the small bar rooms normally reserved for post-operative patients. I knocked out the door and went in. A heap of books was pushed to the side of the table. The books were alien, hostile, superfluous. Next to the books stood a teapot, 2 tin mugs, a bowl full of some sort of kasha. Feel like playing dominoes? Andrei Mikhailovich asked, peering at me in a friendly fashion. If you have the time. I hate dominoes. Of all games, it is the most stupid, senseless, and boring. Even a card game like Lotto is more interesting. For that matter, any card game is better. Best of all would have been checkers or chess. I squinted at the cupboard to see if there wasn't a chessboard there, but there wasn't. I just couldn't offend Andrei Mikhailovich with a refusal. I had to amuse him, to pay back good with good. I had never played dominoes in my life, but I was convinced that no great wisdom was required to learn this art. Let's have some tea, Andrei Mikhailovich said. Here's the sugar. Don't be embarrassed. Take as much as you like. Help yourself to the kasha and tell me anything you like. But then, I guess you can't do both things at the same time. I ate the kasha and the bread and drank 3 mugs of tea with sugar. I had not seen sugar for several years. I felt warm. Andrei Mikhailovich mixed dominoes, and I knew that the one who had the double six began the game. Andrei Mikhailovich had it. Then, in turns, the player had to attach pieces with the matching number of dots. That was all there was to it. And I began to play without hesitation, sweating and constantly hiccuping from fullness. We played on Andrei Mikhailovich's bed, and I got pleasure from looking at the blindingly white pillowcase and the down pillow. On the down pillow, it was a physical pleasure to look at a clean pillow, to see another man rumple it with his hand. Our game, I said, is lacking its main appeal. Dominoes players are supposed to smack their pieces down on the table when they play. I was not joking. It was this particular aspect of the game that struck me as the most crucial. Let's switch to the table, Andrei Mikhailovich said affably. No, that's all right. I'm just recalling all the various pleasures of the game. The game continued slowly. We were more concerned with telling each other our life histories. As a doctor, Andrei Mikhailovich had never been in the general work gang at the mines and had only seen the mines as they were reflected in their human waste, cast out from the hospital or the morgue. I too was a byproduct of that mine. So you won, Andrei Mikhailovich said. Congratulations. For a prize I present you with this. He took from the night table a plastic cigarette case. You probably haven't smoked for a long time. He tore off a piece of newspaper and rolled a cigarette. There's nothing better than newspaper for homegrown tobacco. The traces of typographic ink not only don't spoil the bouquet of the homegrown tobacco, but even heighten it in the best fashion. I touch a piece of paper to the glowing coals in the stove and lit up, greedily inhaling the nauseatingly sweet smoke. It was really tough to lay your hands on tobacco, and I should have quit smoking long ago. But even though conditions were and might be called appropriate, I never did quit. It was terrible even to imagine that I could lose this single great convict joy. Good night, Andrei Mikhailovich said, smiling. I was going to go to bed, but I so wanted to play a game. I really appreciate it. I walked out of his room into the dark corridor and found someone standing in my path near the wall. I recognized Kozlik's silhouette. It's you. What are you doing here? I wanted to smoke. Did he give you any? I was ashamed of my greed, ashamed that I had not thought of Kozlik or anyone else in the ward. that had not brought them a bite or crust of bread, a little kasha. Kozlik had waited several hours in the dark corridor. Shock therapy. During one blissful period in his life, Mrzlakov had worked as a stable hand and used a homemade huller, a large tin can, with a perforated bottom, to turn oats intended for the horses into human food. When boiled, the bitter mixture to satisfy hunger. Large workhorses from the mainland were giving twice as much oats as the stocky, shaggy Yakut horses, although the horses were worked in an equally small amount of time. Enough oats were dumped in the trough of the monstrous Percheron thunder to feed 5 Yakut horses. This was the practice everywhere, and it struck Mrzlakov as being only fair. What he could not understand was the camp's rationing system for people. The mysterious charts, proteins, fats system for people, the mysterious charts of proteins, fats, vitamins, and calories intended for the convict's table did not take a person's weight into consideration. If human beings were to be equated with livestock, then one ought to be more consistent and not hold to some arithmetical average invented by the office. This terrible mean benefited only the lightweight convicts who, in fact, survived longer than the others. The enormous Mrzlakov, a sort of human analog to the Percheron thunder, felt only a greater gnawing hunger from the 3 spoons of porridge given out for breakfast. A member of the working had no way of supplementing his food supply, and furthermore, all of the important foodstuffs, butter, sugar, meat, never made it to the camp kettle in the quantities provided for by the instructions. Mrzlakov watched the larger men die first, whether or not they were accustomed to heavy labor. Scrawny intellectuals lasted longer than some country giant, even when the latter had formerly been a manual laborer. If the two were fed on an equal basis, in accordance with the camp ration, not on an equal basis. If the two were fed on an equal basis in accordance with the camp ration, not calculated for large men, the basic nourishment could not be essentially improved even by food bonuses for heightened productivity. To eat better, one had to work better, but to work better, one had to eat better. Estonians, Latvians, and Lithuanians were always the first to die, a phenomenon that the doctors always explained away by claiming that the peoples of the Baltic states were weaker than the Russians. True, their normal way of life was more dissimilar to that of the camps than was the world of the Russian peasant, and it was more difficult for them. The primary reason, however, was quite different. It was that they possessed less endurance, but that they were physically bigger than the Russians. It wasn't that they possessed less endurance, but that they were physically bigger than the Russians. About a year and a half earlier, Mrzlakov had arrived as a newcomer at the camp. In a state of collapse from scurvy, he had been allowed to work as a stand-in orderly in the local clinic. There he learned that medical doses were determined according to the patient's weight. New medicines were tested on rabbits, mice, or guinea pigs, and human dosages were then calculated according to body weight. Children's dosages were smaller than the adult dosages. The camp food ration, however, had no relation to the weight of the human body, and it was precisely this improperly resolved question that amazed and disturbed Mrzlakov. But before he completely lost his strength, he He miraculously managed to get a job as a stable hand so he could steal oats from the horses to stuff his own stomach. Mrzlakov was already counting on surviving the winter. Perhaps something new would turn up in the spring, but it didn't work out that way. The stable manager was fired for drunkenness, and the senior groom, one of those who had taught Mrzlakov how to make a holler, took his place. The senior groom had himself stolen no small amount of oats in his day, and he knew exactly how it was done. Wanting to impress the administration, and no longer in need of oatmeal for himself, he personally smashed all the hullers. The stable hands began to fry and boil oats and eat them unhulled, no longer making any distinction between their own stomachs and that of a horse. The new manager reported this, and several stable hands, including Mrzlakov, were put in solitary for stealing oats. From there, they were dismissed from the stable and returned to their former jobs in the general work gang. In the general work gang, Mrzlakov soon realized that death was near. He staggered under the weight of the logs that he had to carry. The foreman, who had taken a dislike to this husky man, forced Mrzlakov to carry the thick end of the log every time. At one point, Mrzlakov fell and, unable to get up from the snow, in a moment of decision refused to carry the damn log any farther. It was already late and dark. The guards were hurrying to their political indoctrination session. The workers wanted to return to the barracks, to food, and the foreman was late for the battle at cards. Mrzlakov was the cause of the entire delay, and he was punished. At first his comrades beat him, then the foreman beat him, then the guards. The log remained lying in the snow. Instead of the log, they carried in Mrzlakov. He was freed from work and lay on his berth. His back ached. The paramedic rubbed it with machine grease since there was no rubbing compounds in the first aid room. Mrzlakov kept waiting, half bent over, and insistently complaining of pains in the small of his back. The pain had long since disappeared, but the broken rib healed quickly, and Mrzlakov was attempting at any price to save himself from being signed out to go back to work. And they didn't sign him out. At one point they dressed him, put him on a stretcher, loaded him in the back of the truck, and transferred him with some other patients to the regional hospital. There was no X-ray machine there, and it was time to think things over seriously. Mrzlakov did precisely that. For several months he lay bent in two and was finally transferred to a central hospital, which, of course, had an X-ray machine. There Mrzlakov was placed in the surgical division, in the traumatological ward. The patients and their simplicity referred to the ward as the dramatological ward, not even realized the bitterness of the pun. This one, said the surgeon, pointing to Mrzlakov's case chart. We're transferring you, Peter Ivanovich. There's nothing we can do for him in surgery. But you write in your diagnosis, ankylosis, resulting from a trauma of the spine. What am I supposed to do with him? Asked the neuropathologist. Well, yes, ankylosis. Of course. What else can I write? After beatings, even worse things turn up. I remember there was an incident at the Sari mine. The foreman beat one of the men. I haven't got time to listen to your incidents, Seryosha. I ask you, why are you transferring him to me? It's all written down. He has to be examined before we can make up the papers. You poke him with needles for a while. We do the papers. And we put him on a boat. Let him be a free man. But you did x-rays. You should be able to see any problems without needles. We did x-rays. Take a look. The surgeons held the dark film negative up to a gauze curtain. The devil himself couldn't find anything in that picture. And that kind of smear is all your X-ray technicians will ever produce until we get a regular current. What a mess, said Peter Ivanovich. Okay, let's let it go. At that, he signed his name to the history of the illness, giving his consent to transfer Merslakov to his own ward. The surgical ward was noisy and confusing. The northern mines were serious business, and the ward was filled with cases of frostbite, sprains, broken bones, burns. Some of the patients lay on the ward floor, and in the corridors where one totally exhausted young surgeon with 4 assistants could only manage 3 or 4 patients, 3 or 4 hours of sleep a day, and had only time to examine Merslakov carefully. Merslakov knew that the real investigation would begin in the neuropathologist's ward. His entire despairing convict will was concentrated on one thing, not to straighten out, and he did not straighten out, much as he wanted to, even for a moment. He remembered the gold mine, the cold that left him breathless with pain, of frozen slippery stones, shining with frost, the soup he slurped without a spoon, the rifle butts of the guards, and the boots of the foreman, and he found within himself the strength not to straighten out. Already it was easier than it had been in the first few weeks. Afraid to straighten out in his sleep, he slept little, knowing that all the attendants had orders to keep an eye on him and unmask his duplicity. And after such an unmasking, he would be sent to a penal mine. What must such a penal mine be like, if even an ordinary one left Merslakov with such terrible memories? On the day after its transfer, Merslakov was taken to the doctor. He heard the doctor ask briefly about the origin of his illness and shook his head in sympathy. He remarked in passing that even healthy muscles forced into an unnatural position for many months could become accustomed to the position of a man, and a man could make himself as an invalid. Then Peter Ivanovich took over the examination. Merslakov responded at random to needle pressures and taps with a rubber hammer. Peter Ivanovich spent more than half his time exposing fakers. He, of course, understood the reasons for their conduct. Peter Ivanovich had himself recently been a prisoner, and he was not survived by the childish stubbornness of the fakers or the primitiveness of their tricks. Peter Ivanovich, a former associate professor at the Siberian Medical Institute, had laid his own scientific career to rest in those same snows in which the convicts were saving their lives by deceiving him. It was not that he lacked pity for people, but he was more of a doctor than a human being. First and foremost, he was a specialist. He was proud that a year of hard labor had not beaten the specialist, out of him. He understood his task of exposing cheaters not from any lofty socio-governmental point of view, and not from the viewpoint of morality. Rather, he saw in this activity a worthy application of his knowledge, his psychological ability to set traps into which hungry, half-insane people were to fall for the greater glory of science. In this battle of doctor and faker, the doctor had all the advantages: thousands of clever drugs, hundreds of textbooks, a wealth of equipment, aides from the guards, and the enormous experience of a specialist. The patient could only count on his own horror before that world from which he had come, and to which he feared to return. It was precisely this horror that lent him the strength for the struggle. In exposing any faker, Peter Ivanovich experienced a deep satisfaction. He regarded it as testimony from life that he was a good doctor who had not yet lost his qualification. But, on the contrary, it had sharpened them, who could still do it. These surgeons are fools, he thought, lighting up a cigarette after Merzlakov had left. They don't even know or have forgotten typographic anatomy, and they never did know reflexes. They get along with x-rays alone, and without x-rays they can't even diagnose a simple fracture. And the bullshit they throw around. It was crystal clear to Peter Ivanovich that Merzlakov was a faker. Let him stay for a week. We'll get all the tests worked up to make sure the formalities have been observed, and glue all those scraps of paper into the history of the illness. Peter Ivanovich smiled in anticipation of the theatrical effect of the new exposé. In a week, a new group of patients would be shipped back to the mainland. The reports were compiled right here in the ward, and the chairman of the board of the medical commissioners would arrive to examine personally the patients prepared by the hospital for departure. His role amounted to examining the documents and checking that the formalities had been observed. An individual examination of the patient took 30 seconds. My list, said the surgeon, contained a certain Merzlakov. The guards broke his back a year ago. I want to send him home. He was recently transferred to neuropathology. The papers for his departure are ready. The chairman of the commission turned to the neuropathologist. Bring in Merzlakov, said Peter Ivanovich. The bent-over Merzlakov was led in. The chairman glanced at him. What a gorilla, he said. But I guess there's no reason to keep that kind around. Pen in hand, he reached for the lists. I won't give my signature. And Peter Ivanovich, in a clear, loud voice, he's a faker, and tomorrow I will have the honor to prove that to both you and the surgeon. Let's set him aside then, said the chairman indifferently, putting his pen down. And in general, let's wrap things up. It's already getting late. He's a faker, Seryozha, said Peter Ivanovich, taking the surgeon by the arms as they were leaving the ward. The surgeon withdrew his arm. Maybe, he said with a disgusted frown. Good luck on exposing him. I hope you get your kicks out of it. The next day, Peter Ivanovich gave a detailed report on Merzlakov to the head of the hospital at a meeting. I think, he said in conclusion, we'll expose Merzlakov in 2 stages. The first will be the Rausch narcosis that you forgot, Seryozha. Triumphantly, he turned to the surgeon. That should have been done right away. And if the Rausch doesn't produce any results, then? Peter Ivanovich spread his hands in a gesture of resignation. Then we'll have to try shock therapy. I assure you, that can be very interesting. Isn't that going too far? Alexandra Sergeyevna said. She was a heavy woman who had recently arrived from the mainland. Here she ran the tubercular ward, the largest ward in the hospital. Not for that son of a bitch, the head of the hospital answered. Let's wait and see what kind of results we get from the Rausch, Peter Ivanovich inserted in a conciliatory fashion. Rausch narcosis consisted of a stunning dose of ether for a short-term effect. The patient would be knocked out for 15 to 20 minutes, giving the surgeon time to set a dislocation, amputate a finger, or open a painful abscess. The hospital bigwigs, dressed in white gowns, surrounded the operating table at the dressing station where the obedient stooped over Merzlakov was brought. The attendants reaching for the cotton strips normally used to tie patients down to the operating table. No, shouted Peter Ivanovich, that's totally unnecessary. Merzlakov's face turned upward, and the surgeon placed the anesthetic mask over it, holding a bottle of ether in his other hand. Let's begin, Seryozha. The ether began to drip. Deeper, breathe deeper, Merzlakov. Count out loud. 26, 27, Merzlakov counted it in a lazy voice, and suddenly, breaking off his count, started to mutter something fragmented, incomprehensible, and sprinkled with obscenities. Peter Ivanovich held his hand, the left hand held in his hand the left hand of Merzlakov. In a few minutes, the hand fell limp. Peter Ivanovich dropped it, and the hand fell softly onto the edge of the table, as if dead. Peter Ivanovich slowly and triumphantly straightened out the body of Merzlakov. Everyone gasped with amazement. Now tie him down, said Peter Ivanovich to the attendants. Merzlakov opened his eyes and saw the hairy fist of the hospital director. You slime, he hissed. Now you'll get a new trial. Good going, Peter Ivanovich, good going, the chairman of the commission kept repeating, all while slapping the neuropathologist on the shoulder. And to think that just yesterday I was going to let him go. Untie him, Peter Ivanovich commanded. Get down from that table. Still not completely aware of his surroundings, Merzlakov felt a throbbing in his temples and a sickeningly sweet taste of ether in his mouth. He still didn't understand if he was asleep or awake, but perhaps he had frequently had such dreams in the past. To hell with all of you, he shouted unexpectedly and bent over as before, broad-shouldered, bony, almost touching the floor with his long, meaty fingers. Merzlakov looked like a gorilla as he left the dressing station. The orderlies reported to Peter Ivanovich that patient Merzlakov was lying in his bed in his usual pose. The doctor ordered him to be brought to his office. You've been exposed, Merzlakov, the neuropathologist said. But I put in a good word for you to the head of the hospital. You won't be retired or sent to a penal mine. You'll just have to check out of the hospital and return to your previous mine, to your old job. You're a real hero, brother. Make us look like idiots for a whole year. I don't know what you're talking about, the gorilla said without raising his eyes from the floor. What do you mean you don't know? We just straightened you out. Nobody straightened me out. Okay, friend, the neuropathologist said. Have it your own way. I wanted to help you out. Just wait. In a week, you'll be begging to check out. Who knows what'll happen in a week, Merzlakov said quietly. How could he explain to the doctor that an extra week, an extra day, an extra hour spent somewhere other than the mine was his concept of happiness? If the doctor couldn't understand that himself, how could he explain it to him? Merzlakov stared silently at the floor. Merzlakov was led away. Peter Ivanovich went to talk to the head of the hospital. We can handle this tomorrow, and not next week, the head of the hospital said upon hearing Peter Ivanovich's suggestion. No, I promised him a week, Peter Ivanovich said. The hospital won't collapse. Okay, the head of the hospital said. We can handle it next week. But be sure to send for me when you do. You will tie him down? We can't, the neuropathologist said. He could dislocate an arm or a leg. He'll have to be held down. Merzlakov's case history in his hand, the neuropathologist wrote shock therapy in his treatment column and inserted the date. Shock therapy consisted of an injection of camphor directly into the patient's bloodstream. The dose was several times that were used in hypodermic injections for seriously ill coronary patients. It produced a sudden seizure similar to seizures of violent insanity or epilepsy. The effect of the camphor was a radical heightening of the muscle activity and the motor ability. Muscle strain was increased incredibly, and the strength of the unconscious patient was 10 times that of normal. Several days passed, and Mrzakov had no intention of voluntarily straightening out. The morning of the date scheduled in the case history arrived, and Mrzakov was brought to Peter Ivanovich in the north. Any sort of amusement is treasured, and the doctor's office was packed. 8 husky orderlies were lined up along the wall. In the middle of the office was a couch. "We'll do it right here," Peter Ivanovich said, getting up from behind the desk. "No sense going to the surgical ward. By the way, where is Sergei Fyodorovich?" "He can't come," Anna Ivanovna, the physician on duty, said. "He said he was busy." Busy, Peter Ivanovich repeated. "But he ought to be here to see how I do his job for him." The surgeon's assistant rolled up Mrzakov's sleeve and smeared iodine on Mrzakov's arm. Holding the syringe in his right hand, the assistant inserted the needle into a vein next to the elbow. Dark blood spurted from the needle into the syringe with the soft movement of the thumb. The assistant pressed the plunger, and the yellow solution began to enter the vein. "Pump it in all at once," Peter Ivanovich said, "and stand back right away. You," he said to the orderlies, "hold him down." Mrzakov's enormous body shuddered and began to thrash about, even as the orderlies took hold of him. He wheezed, struggled, kicked, but the orderlies held him firmly, and he slowly began to calm down. "A tiger! You could hold a tiger that way," Peter Ivanovich shouted in near ecstasy. "That's the way they catch tigers in the Zabaikal region." He turned to the head of the hospital. "Do you remember the end of Gogol's novel, Taras Bulba? 30 men held his arms and legs. This gorilla is bigger than Bulba, and just 8 men can handle him." "Right," the head of the hospital said. He didn't remember the Gogol passage, but he definitely enjoyed seeing the shock therapy. While making rounds the next morning, Peter Ivanovich stopped at Mrzakov's bed. "Well," he said, "what's your decision?" "I'm ready to check out," Mrzakov answered. Okay. Thank you for listening. Have a good day.